Good morning everybody. On behalf of SIMS Hospital and our chairman, I would like to welcome Dr. Bashi and Dr. Ibrahim for this press meet. This is a rare case scenario because a lot of endoscopic surgeries are happening for abdominal surgery, thoracoscopic surgery, whereas cardiac surgery it is a rare phenomenon. And especially in the ventricle there are 4 chambers and all the details will be discussed about with the help of the cardiothoracic surgeon. This is a very rare scenario because only whole world they have done only 2 cases. That is only in the left atrium. This is the left ventricular tumor has been performed successfully, and they will explain the detail. For this, they need a infrastructure facility, endoscopic, and our hospital has got the robotic equipment also available. He has previously done the middle procedure with robotics. So many minimal invasive procedure has been done. They can go within 2 days. These are the advantages. With all this, with a note, I would like to welcome Dr. Bashi to explain about the details about this procedure.
Thank you all for coming over this morning. See, I am doing heart surgery for the last 45 years. So, conventional operation only where we cut the breastbone. Just like that one. Yeah. So we cut and stitch here. You know, the big bone cut open, then put the patient on heart-lung machine, stop the heart and do it. So, the disadvantages of cutting this, you know, the recovery time is little more. Sadharanama for 6 weeks, patients can go back to the 6 to 8 weeks ago. The minimally invasive, abdominal surgery, gallbladder, liver, kidney, urology எல்லாம் நிறைய பண்ணிட்டு இருக்கு. ஹார்ட்டில் அது பண்ணோன்னா இட் இஸ் வெரி டிஃபிகல்ட். ஏன்னா ஹார்ட் ஸ்டாப் பண்ணணும், அதுக்குள்ளே இருக்கிற நல்லா பார்க்கணும், கிளியராக ஹார்ட்டுக்கு டேமேஜ் இல்லாமல் we have to do the operation. ஸோ அட்வான்டேஜ் இந்த கேஸில்னா he will டாக்டர் இப்ராஹிம் எக்ஸ்பிளைன் பண்ணுவார். இப்போ நம்ம டிபார்ட்மெண்ட்டில் ஐ ஹவ் டெவலப்ட் a separate department for minimally invasive surgery. It is headed by my colleague Dr. Ibrahim. He had a higher training for 2 years. இதிலே ஸ்பெசிஃபிக்காக பண்ணிட்டு தான் இந்த ஆப்ரேஷன் பண்ணுறது. அப்போ இங்கே சின்ன ஒரு ஹோல் பண்ணிவிட்டு ஹார்ட் லங் மெஷின் கனெக்ட் பண்ணி வென்ட்ரிக்கிளுக்கு உள்ள டியூமர் எடுத்துட்டு மறுபடியும் ஹார்ட் ஸ்டார்ட் பண்ணணும். டீட்டெயில்ஸ் அவர் சொல்லுவார். ஸோ ஒன் திங் ஐ வாண்ட் டு டெல் அபவுட் minimally invasive surgery, especially heart robotic alone, not like other surgery like general surgery or urology or any other thoracic, any other abdominal procedure. The surgeon is at risk, not the patient. Because trying to save the patient, surgeon has to adopt different positions. Sometimes you will have severe back pain because you have to do the operation through a small hole, the whole thing, and keep the patient alive after surgery. So it is a very difficult procedure for the surgeon who is doing that. Not many patients realize that. They all want everything very easy, but we need hours and days and months of training because to do a major procedure through a small hole is not easy. And other vishayam adillame we need, as Dr. Raju mentioned, high-tech equipments are necessary. The high-tech cameras, then endoscope, plus instruments, long instruments, special technique for tying the sutures, all are necessary to do the operation. I was talking to a few youngsters because I don't do minimally invasive. It is done by my young colleagues only. Some surgeons who have been doing minimally invasive surgery after 3-4 years, they themselves have developed heart, backache, neck pain, all those things the public does not know. Something that's an occupational hazard for the surgeon, especially in heart surgery. So the public also should know about it. They want, suppose a chinna mistake vandata, they blame the surgeon only. Something has gone wrong because no surgeons make mistakes purposefully. When you do such delicate surgery, sometimes the accuracy may not be correct as we want. So this needs a lot of infrastructure from different departments to do the procedure, and expensive equipments also. So the details but now my colleague will explain everything about this particular patient, because heart tumor left 4 chamber irukku heart ku, 2 upper chambers, 2 lower chambers. Upper chamber tumor is not uncommon. That's called left atrial myxoma. Ventricle, left ventricular tumor is very, very, very rare. In 45 years, I am seeing the first case among about 25,000 patients I have operated. This is the first case in Angapakuru. Okay, so Ibrahim will tell you the details. Yeah, you can present the case now. Working people only coming for operation. Young, for example, she is saying. So, instead of taking 2 months for recovery, in 2 weeks she can go for a job. She can earn her bread. That is the advantage of this minimally invasive techniques which have advanced all over the world. See, now when you do angioplasty and stenting for the heart, they go for work after 1 week. When you do an operation, it may take another 6 weeks or 8 weeks to go for work. So idea of all this so-called minimally specialty minimally invasive is developing. Robotic surgery is coming in a big way in the United States. Inga the varame karanam cost jaasti arugum. Ivarku namma aalku yarukku afford panna mudiyadhu andha madiri cost. So in the US and all, it is being done by robots. But one robot will cost about nearly $10 million, the latest. That's about nearly, you can calculate how much it will come. It is very, very expensive, the latest this thing. So whenever we can do and trained people are there, minimally invasive, patient also ask for that nowadays. Most of the people are educated, they know what is available in the market. If you go to the internet, okay, I got a tumor, who is doing it immediately in 5 minutes you will get. Because you also are responsible for people knowing these things. That is one of the reasons we are conducting this meeting, to make people aware these are the things available today. If you want such and such people are doing, it is okay. You can go for work with the same result, with a better cosmetic thing, and early returning to work.
Sir, you said time is money. Is it covered under SIMS insurance policy?
I don't know about it. I have no idea. I don't think so.
So what will be the cost, conventional one than this one?
As there is not much difference. We are not charging extra for this. When you use robotic, definitely we will have to charge more. This one, that is what I was telling you. The strain is more on the surgeon who is doing the procedure. Patient, it is less stressful. So as such, because the problem is our patients, most of them cannot afford much. So at the moment we are doing with almost the same. When we use high grade equipments for endoscopic things, that scope charges we will have to levy to the patient.
What's the difference of cost?
Maybe I would say about 25% more. That's all, than a conventional operation. Only other problem is theatre time extra. Normal operation, if you do, say I take say 4 or 5 hours, sometimes this may take little more than that. But trained, as you get more and more operation, doctors get trained more, time will be almost the same.
Learning curve.
Learning curve it is called.
How many doctors were trained for this?
In our unit, he is the one who is trained for that.
So this operation, can you say is first in India or the first in
Yeah, this one is for a tumor from the left ventricle done through this is first in India only. To our knowledge, yeah, definitely.
Patient anesthesia கொடுத்துட்டீங்க. அப்புறம் ரைட் லெக்ல வெயின்ஸ் வழியா blood circulation. இந்த தமிழ் prescribe இருதய நுரையீரல் இயந்திரத்தின் உதவின்னு சொல்லி.
The heart lung machine.
இப்போ நம்ம ஒரு ஆபரேஷன் பண்ணும்போது ஹார்ட்ல ஆபரேஷன் பண்ணும்போது ஹார்ட்டை நிறுத்திட்டு தான் பண்ண முடியும். இப்போ heart has to function with the lungs. Heart and lungs work together. The lungs give oxygen into the blood. Heart function is collect the impure blood, pump it into the lung, and lung will give oxygen, and the oxygenated blood comes to the heart. That's our body மூளையிலெல்லாம் போகும். இப்போ heart நிறுத்தும்போது lungs also will have to stop. So there is a machine which we use. One is the artificial lung, another is the artificial heart. இப்போ impure blood எடுத்து ஆக்சிஜனேட்டரில் போட்டு ஆக்சிஜனேஷன் பண்ணிவிட்டு அது பம்ப் இன்டு தி பேஷண்ட் த்ரூ தி அயோர்ட்டா. அதுதான் ஹார்ட் லங் மெஷின் ஒர்க்கு. அந்த டைமில் பேஷண்ட் வேணால் கூல் பண்ண சில டைமில் இப்போ நாங்கள் அயோர்டிக் சர்ஜரி எல்லாம் பண்ணும்போது சர்க்குலேஷன் நிறுத்த வேண்டியது வரும். இந்த மெஷினில் பிளட்டு கூல் பண்ணதோ ஃபெசிலிட்டி கூட இருக்குது. சம்டைம்ஸ் வில் கூல் பிளட் 20 degrees 15 degrees எல்லாம் கம்ப்ளீட் ஹோல் பாடி கூல் ஆகிட்டு the body all will be sweating because of the cold. Circulation கம்ப்ளீட்டாக நிறுத்தலாம் for half an hour. Nothing will happen to the brain tissues. எல்லாம் நிறுத்திட்டு சர்ஜரி பண்ணுவேன். அதான் அட்வான்டேஜ் ஆஃப் ஹார்ட் லங் மெஷின்.
ஹார்ட் பீட்டை வந்து ஸ்டாப் பண்ணுறது இந்த ஹார்ட் பீட்டை மேக்ஸிமம் எவ்வளோ நேரம் வரைக்கும் ஸ்டாப் பண்ணுறது?
ஒரு மினிமம் 5 to 6 hours நிறுத்தலாம். அந்த டைமில் ப்ரிசர்வேட்டிவ் இன்ஜெக்ஷன் போட்டுகிட்டே இருப்பார். எவ்ரி half an hour we inject medicines into the heart so that heart will be protected.
This type of operation can be done for all ages.
Yeah, all ages it can be done.
No,
Yeah, all.
age, old age.
No contraindication for
Is
age.
there any exclusion of high risk groups like pregnant women or anything like that? Or?
ஒன்லி எக்ஸ்க்ளூஷன் முன்னாடி ஏதாவது ஆப்ரேஷன் பண்ணியிருக்கிறாங்க ஹார்ட்டுக்கு அந்த மாதிரி இருந்ததுன்னா. ரெண்டாவது நுரையீரல்லாம் வந்து ரொம்ப மோசமாக வேறு ஏதாவது கோமாபிலிட்டிஸ் நிறையா இருக்குது. ப்ளஸ் இப்போ வேல்வ் ஆப்ரேஷன் பண்ண போகிறோம், அவங்களுக்கு பைபாஸும் தேவைப்படுது, கம்பைன்டு லீஷன்ஸ் இருக்குது. இல்லை மோர் காம்ப்ளிகேட்டட் ஹார்ட் ப்ராப்ளம்ஸ், ஹார்ட்னுடைய ஃபங்க்ஷன் ரொம்ப வீக்காக இருக்குது, பேஷண்டோட சப்செட் ரொம்ப புவராக இருக்காங்க, அவங்களுக்கு வந்து இந்த மினிமலி இன்வேசிவில் ரொம்ப நேரம் எடுக்கும், இல்லை எங்களால் துல்லியமாக சரியாக பண்ண முடியாதுன்னு தோணுனாலும் we don't subject them to experiment. நாங்கள் ரெகுலர் ஆப்ரேஷன் சேஃபர்னு ஃபீல் பண்ணால் we do regular operation.
That means conventional is safer.
Conventional is much safer. We have full control over it.
Okay.
Minimal invasive, we can select good subset of patients and do it.
And as experience becomes more, practice makes you perfect.
Yes.
If I am doing only minimally invasive for 5 years, I can do the same speed as a regular operation. Because I am doing only that. But what is happening in our setup in our country is because of the load is more, patients cannot afford. We try to do the regular operation because easier, faster, less expensive. So Western countries, they are not worried about money. Here most important thing is the cost factor. I worked 4 or 5 years abroad. Australia, nobody comes about, sir, how much it will cost, how many, no question about it. Cost nobody will ask because insurance covers everything. When the patient, the first thing we have to see how we can manage him with the minimal cost. That is a big pressure for the person who is doing the surgery because to adapt accordingly. Sometimes we'll have to cut some corners to make sure the cost is less. Yeah.
மார்போட நடுவில் இருக்கிற வெயிட் தான்
He's asking, one second. He's asking.